Hey guys, welcome to a new episode of A Sip of Aesthetics. I'm your host, Dr. Abraham, and today we have a new guest with us.
Hi, my name is Marla. I am an esthetician here at New Spa. I've been practicing for 15 plus years, and I'm excited to be here to answer some questions.
Today we're going to be talking about skincare, so I definitely wanted to have Marla on the show because she's an expert to come when it comes to that.
Oh, thank you.
Of course. I mean, I do a lot of injections. I use my products. I know what's in the products, but at the end of the day, I'm just a guy. So,
well, sometimes it's all about just finding what works for you, what ingredients work for you, what products work for you, and sometimes it can be trial and error. You know, there's some great products out there that are sold here at med spas that are more medical skin grade, and then there are great products that you can buy at CVS and at Target that work really well too.
Absolutely. And, for our listeners, like for somebody, maybe we can start with like somebody who's kind of completely new, and then we can get a little bit more into some more details as we go on. So like what, for somebody who just wants, to take care of their skin, obviously I would say like sunscreen is really important because you want to prevent sun damage. But what are like the, first 2 or 3 things that everybody should have?
Yeah, so definitely, sunscreen for any age is really important. I would recommend to start using it on your children every day as young as possible, but I know there can be a fight. I think it depends on their age. So if they're more in like early 20s, it's important just to have, in my opinion, a good cleanser and a double cleanse at that. So anything that's kind of in like a gentle foaming cleanser, or you can start out with an oil cleanser and finish with a gentle foaming cleanser, something that's just really going to get the day off all that dirt, oil, debris, grime, environmental factors that can come from, wind and just being outside in general. And then I would say at nighttime, a good serum or moisturizer, just kind of depending on, if your skin's on more the oily side or more on the dry side, and then a good SPF, and in my opinion, using a mineral SPF is best, so something that doesn't have a chemical component to it.
Gotcha. And, when it comes to sunscreens, you mentioned there's the mineral SPF, and, there's like mineral SPF, mineral sunscreens, which the sunscreen would be more used throughout the day, right?
Yeah.
And then there's mineral and there's chemical, and you said you prefer mineral.
Yeah, I do prefer a mineral sunscreen. So with a mineral, it's going to create a barrier on the skin where the UV is going to actually bounce off the physical barrier, whereas a chemical sunscreen, the UV actually penetrates into the skin and then is bounced off of that, to my understanding. And also, there has been a lot of science that's come out about the different chemicals and how it can create some hormone imbalances and specific things. So I find that a mineral sunscreen is probably just best for overall health in general. And that's a titanium dioxide or a zinc base, and some chemicals.
And I actually do prefer the mineral sunscreen as well, just because there's less absorption of the chemicals, as you mentioned, with some of the other ones. So perfect. So we've talked about cleanser, sunscreen, nighttime moisturizer or cream. What's a toner, and when is that used?
Oh, I'm the wrong person to ask about toner. Toner, I feel like, does have its place in a skincare routine, but for somebody who wants to have a little bit more of a simplistic skincare routine, I don't think toner is the most necessary. Yes, it can bring your skin back to a neutral pH so that it's able to then absorb a serum and a moisturizer a little bit better. But in all honesty, I think you can skip the toner. I do think there's some good ones out there, maybe spray hydrators, or in place of a toner, if you do like something on a cotton round, something that maybe has like an AHA or a BHA component to it, that's going to help with exfoliation. I think they're kind of like the new age toners in place of where a toner used to be put into a skincare regimen.
And so with AHA and BHA, those, can you just talk a little bit more about these and why? Because people are using them more and more. So like, why are people using them? What are some of the benefits?
Alpha hydroxy acid and beta hydroxy acids are really, have become more popular in the last 5 or so years. But what they can do is they can promote cell turnover when they're put on like a cotton round and kind of used all over the face. It helps to get any extra oil residue that was maybe left behind by the cleanser. But it can also promote that cell turnover, so we're getting that exfoliation, that lighter exfoliation than say like a chemical peel or a retinol. So it's nice to kind of throw in 2-3 times a week.
And we haven't even really discussed like the other creams with active ingredients, like an anti-aging cream, which people might want to start using, and like under eye creams and night creams. But like I guess another question is, there's so many different products out there. When it comes to cleansers, there's different cleansers, there's different toners. If somebody does want to use a toner, there's a lot of different anti-aging creams. So like, how would you know, like, are they all the same, or does it depend on each person? Should they come in and have maybe a consultation with somebody who's an expert just to maybe set them, like, what's the value of that?
Yeah, I do think it's important to understand the clients, their skin type, their age, what their goals are, and also like what's going to fit into their budget and lifestyle. So I do think using like a serum and moisturizer combo for nighttime is really beneficial. That's where you can get those heavy hitting ingredients, and then the moisturizer can really lock those ingredients in. That's going to give them that anti-aging benefit, but also the hydration that they're looking for.
And I know, like, there's, some people are going to have more of a dry skin versus an oily skin versus a neutral skin, and there's different products that could be formulated, for that. But that's why, like, sometimes also getting that evaluation with an expert can be very beneficial.
Absolutely. Coming in to get that evaluation. And sometimes, not that people are wrong, but sometimes they can be off. Sometimes they think they have a more oily skin, but actually it's more the skin's dehydrated and it's going into overdrive and creating more sebum. So once they kind of balance that with actually like a good, maybe thicker moisturizer, instead of always buying like an oil-free or, always maybe not skipping moisturizer, they can actually get into a more balanced state. And then also the weather has so much to do with it, especially in Southern California here. We're so dry. We're in the Santa Ana winds. I feel like I wake up and no matter how much I sludge all over my face, I wake up and I'm dry and, cracked. So it's just really finding those products that work for you.
And I think it's a great investment, because if you are like spending all that money, but it's not really the right product for you, versus getting like that, expert opinion initially, is going to help you make these better decisions. You're not like you're spending money on the wrong thing. But sometimes, I've seen you do that, where people will come in and they're using like 15 different products, and they're all like, you don't need all of these. Maybe just use like 3 or 4 that are more medical grade, as you mentioned, or just more gentle, more like more appropriate for your skin.
Yeah, absolutely. I like to say, when in doubt, take something out. And I feel like sometimes I'll ask clients, what are you using? And they're rattling off, 15 plus different products. They have a nighttime, a morning time routine. It's, what's new at Sephora, or what did they see on a commercial? And a lot of women have half-used bottles all over the place, and they're ending up, not really getting the full benefit, or even seeing if their skin is liking a certain product, because we're kind of jumping to the next one. So I think, coming in, getting an evaluation, really investing in good, medical grade skincare, I think is going to give you the most benefit over, something that is maybe a little weaker, a little less concentrated, or maybe using some other filler ingredients that are more like over-the-counter brands. Not to say that there aren't really good ones out there, but I do think that the medical skincare lines, spend a lot of time, money, and energy on clinical studies and trials, and really have a lot of data, to back up their claims.
And I think that's kind of one of the things about coming to a place like here, or any other place where there's like a team of estheticians and providers, is that sometimes we are also combining like prescription medications, like something like tretinoin or something for the client that needs it, with the appropriate kind of skincare line that agrees with it. And so kind of having this holistic approach can be very, very useful. Because sometimes for some people, maybe not for everybody every time, but sometimes prescription, medications can also play a role, I think, in anti-aging.
Oh,
this stuff.
absolutely. I mean, tretinoin is the biggest example of that. You know, there's a lot of products out there that will claim to have retinol in it or retin A in it or vitamin A in it, but really tretinoin is going to be the heavy hitter. That's going to be, 20 times more effective than over-the-counter retinol. And that's something that is usually, a prescription or, made at a compounding pharmacy that you can get at a medical facility.
And at the same time, also like, because here we do a lot of like aesthetics procedures, so pairing those things with like let's say like a facial or maybe a laser or a cream, because to me like skincare is so important, and it's just it's a piece of the puzzle. But really, for the best results, it's kind of like you want to go and get when you go to the dentist, you want to fix any problems. Get a cleaning every once in a while, but you also want to brush your teeth every day. It's kind of how it feels in a sense with the skincare. You want to have the right skincare that you're using every day, but you want to pair it with whatever other procedure your skin needs. And again, like you said, factors like age, type of skin, what kind of problems the person might be having, all play a role.
Absolutely. It's like protecting your investment. If you're coming in here, you're getting Botox, you're getting hydrofacials, you're getting microneedling, all the different things. It's like you do want to pair it with a medical grade skincare so that you're getting all the benefits and, not just, somewhat taking care of it at home and expecting this to do all the heavy lifting. So.
And I know I kind of started as a joke saying, well, I'm a boy, but there is a truth in my personal experience. You actually know a lot about skincare. No, but the thing is, I need to be better at it, because like a lot of times, honestly, I'm consistent with it for like even just a few weeks, and I feel a huge difference in my skin, and then I can be, I kind of fall off the wagon and I don't take care of it as much, and I can tell a difference. And I feel, but the point I'm trying to get to is even for guys, like a lot of times, guys don't pay as much attention to their skin, but I think even for men, it's really important. And like, there are certain products out there, like I found one that it's like less steps. So like, for instance, I use Epicutis because it's like just kind of, in a sense, like 1 or 2 steps, and it might not be as good as somebody who has a more complete, routine, but it works very well, and it makes it easier. So it's kind of like comes back to that personalization, for each individual. Some people might want to, do something that's like quicker and easier, versus some people are going to have like, they are more invested into, doing a more complete routine. And you can find, a good solution for each person, depending not only on their age and skin type, but also like, what are they going to be compliant with?
Absolutely. And I think, like you said, there's some people that don't want so many steps, so that's why Epicutis is so nice. I mean, you're able to kind of just do a dropper full of the serum and put it all over. I love that you're able to put it all over your eyelids. I put it in my lips. I'll put it in my nose if it's feeling dry. Like, I'm bringing it all the way down here. And it's just nice. It's like one step, and then you can just put a touch of cream on top, instead of having a separate serum for this and eye serum for this and moisturizer and then a topper moisturizer. It's about finding what works for the patient. And especially, I think, too, men like something that absorbs really nicely and doesn't feel heavy or like a film on the skin. So there's, certain sunscreens that I have, used over the course of the years and that we sell here that I'm like, your boyfriend's going to love this. Your husband's going to love this. It's easy. It absorbs. There's no white cast. Trust me. I've seen it all. They're going to love this one.
For sure. And I just want to kind of like, because I think we should wrap up. I'm just going to finish by saying you always will also like, do the basics, stay hydrated, make sure, I think nutrition just plays a role in everything. So, eating the right food, try to manage stress as much as possible, much easier said than done. But I do believe that honestly, like a good skincare routine plays such an important role when it comes to the health of our skin. And the health of our skin can be in a way like a reflection of our overall how we feel. And it's not crazy to say that, when I have a healthy skin and I feel good about my skin, I just feel good overall, like perfect. Well, thank you guys for joining us. If you have any questions, send us a DM, leave a comment, make sure you like and share, and hopefully we'll see you next week on the next episode.
Yeah, thanks for having me on. This was fun. See you guys soon. Bye.